Hello everyone, welcome to a new session on systemic pathology. So, I would like to first start with cardiovascular system pathology. Out of that, the first topic I'm going to discuss is blood vessels. Before going to the various diseases or abnormalities of the blood vessels, we should know about the normal anatomy of the blood vessels, the normal vascular responses to injuries. Because the basic pathogenetic mechanism behind all vascular diseases remains the same. So remember, vascular pathology is one of the most common causes of both morbidity as well as mortality in the human being. The two most important principal mechanisms, see, if you remember these 2 points itself, you can write by your own. Because these are the two important principal mechanisms, which underlies any vascular pathology. Number one is what we call it as narrowing or stenosis or complete obstruction of the blood vessel. For example, this is a blood vessel, this is a blood vessel, and these are the various walls we can see, and what you are seeing, I am labeling, is the lumen of the blood vessel. This lumen may be, I am drawing an yellow color, it may be partially occluded, we call it as stenosis, or it may be completely occluded, we call it as obstruction. What is the reason? Maybe due to any atherosclerosis, any precipitating factor like thrombosis or embolism, and finally the weakening of vessel walls. We will learn some conditions like that. Aortic aneurysm, aortic dissection, which will finally lead to dilation and rupture of the blood vessels. So, that's all. Then coming into the basic anatomy of the blood vessels. This is, suppose I'm going to draw a blood vessel here. I'm going to draw a blood vessel here. This is a cut section of the blood vessel. This blood vessel, I'm going to take a cut section. I'm going to draw here. Yes. What are these layers? From outside to inside, we have tunica intima, tunica media, and this outermost layer is called as tunica adventitia. Tunica intima is made up of endothelial cells. Tunica media is made up of smooth muscles plus elastic tissue. In arteries, we have mainly elastic tissue, and adventitia, we have fibrous tissue, of course, plus smooth muscle components. This is the basic structure. This is the basic structure of what? This is the basic anatomy of blood vessels. You should know this. Once this is done, see, I'm going to compare between arteries and veins. Arterial walls are thicker, so there is more pulsatile flow, higher blood pressure. As the arteries become narrower, the ratio of wall thickness to the lumen diameter increases. That means the thickness decreases, the lumen diameter increases. So it is the reason because of which the muscular vessels, we have arterioles, small and muscular arteries, they are responsible for maintaining the blood flow and blood pressure. They are mainly responsible for maintaining blood flow and blood pressure. Fine. So, atherosclerosis mainly affect elastic and muscular arteries. Please remember this point. Hypertension mainly affect muscular arteries and arterioles, whereas vasculitis, it may affect any of this, large vessel, medium, small, everything. So just remember these two basic points. I have already told you what are the constituents of the blood vessel walls. We have the endothelial cells, smooth muscle cells, extracellular matrix, which includes the elastin, collagen, glycosaminoglycans. Then I have already told you what are the various layers. We have the intima, we have adventitia, and we have media. Yes. then you already know what are the differences between. For example, I am taking an elastic artery like aorta. There will be thick tunica media. Am I right? And the tunica media mainly have elastic tissue. At the same time, I am taking a muscular artery. For example, femoral artery. Okay, or the popliteal artery. What is happening? The tunica media is going to have more smooth muscle. So these are all the very basic points that you already know. Fine? Yes. Okay. Out of all the three layers, which is the layer which is most anatomically distinct in the arteries? Your answer should be tunica adventitia. Tunica adventitia is the most anatomically distinct in case of arteries. I have already told you tunica intima is there, which are endothelial cells. It is demarcated. That means, for example, this is tunica intima, this is tunica media. In between, I am drawing a layer. This is called as internal elastic lamina. This is called as internal elastic lamina. Okay, internal elastic lamina. Okay, fine. Yes, then remember, arteries have well organized arrangement of smooth muscle cells. That is concentric arrangement, whereas it is more haphazardly arranged in veins. That is, veins looks like collapsing. Am I right? It has very thin walls. And remember the media of elastic arteries and what happens to that of the muscular arteries. I told you, that is the amount of elastic tissue is more in case of elastic arteries and less in case of muscular arteries, and it is the reason because of which the elastic recoil, am I right, aortic recoil is characteristically present in large blood vessels like aorta. Am I right? Yes. And at the same time, remember, in these arteries, that is large elastic arteries, what will happen because of the loose or because of the loss of elasticity in the old age, these arteries may undergo dilatation. We call it as ectasia. Ectasia means what? Abnormal dilatation or protrusion. At the same time, muscular arteries, they are predominantly made up of circumferentially oriented smooth muscle cells, and it is this arterial smooth muscle cell contraction that is responsible for vasoconstriction and vasodilation. That is why I am telling muscular arteries are responsible for mainly BP control, blood pressure control is a main function of muscular arteries. All these are very basic important points, because once you are thorough with these basic points, it is very easy, okay, to understand the vascular pathology like hypertension, atherosclerosis and all those things. Okay, then what are the resistance vessel? Remember, arterioles are the resistance vessel. You have a formula, no? Resistance would have already learned in physiology that resistance is inversely proportional to fourth power of radius, and you have another one formula called as Poiseuille's formula. What is that? Q is equal to, that is the rate of flow is directly proportional to fourth power of radius, and it is inversely proportional to the length of the blood vessel and the viscosity. Pi p r raised to 4 divided by 8 eta. This is called Poiseuille-Huygens equation. Fine. Yes, that means if the diameter is halved, what happens to the resistance? It increases to 16-fold. Okay, so arterioles have small radius. That means it is having small radius means what? At the same time, it is arterioles. Am I right? Yes. So any small decrease in the lumen size of the arteriole, it will have profound effect on the blood pressure, because I told you it is the arterioles, the small blood vessels are mainly responsible for maintaining the blood pressure. Then I have already told you about adventitia. Okay, that is the outermost layer. It is separated from media by what we call it as external elastic lamina. Okay, I am going to draw here external elastic lamina. Okay, for example, this is what we call it as the tunica adventitia. I am going to draw a red color. This is what we call it as external elastic lamina. External elastic lamina. Okay, yes, fine. Then I told you about the large elastic arteries. Examples are our subclavian, common carotid, iliac and the pulmonary arteries. Medium sized arteries are the muscular arteries, which comprise of the coronary and the renal arteries, and we already know about arterioles. What are capillaries? They are having an endothelial cell lining, but there is no tunica media present in capillaries, and they are surrounded by some modified endothelial cells called as pericytes. What is the function of this pericyte? Yes, this contraction of this pericytes. This pericytes actually nothing else but some modified smooth muscle cells. Okay, this contraction leads to tissue perfusion. Okay, yes, so these are the most important points you have to remember. Then about the lymphatics, not only it is the blood vessels which mainly helps in the fluid balance in our body, but also the lymphatics. Okay, yes, in the last of this chapter we will be also discussing some of the lymphatic abnormalities also. Okay, towards the end of the chapter, blood vessels. Fine. Okay, then about veins. What is the specialty of veins? Thin vessels, but they have highest smooth muscle. They have very high smooth muscles in the tunica adventitia and the tunica media. In tunica media, we don't have any elastic tissue in case of veins, and venules, they have more smooth muscle content. Fine? Yes. Okay, so I told you, except capillaries, all vessels have three-layered structure: intima, media, adventitia, arteries, veins, everything. Capillaries don't have what tunica, media. I'm going to write that point again. Okay, what is that? Capillaries, no tunica, media. Okay, they may ask these basic questions. Okay, they may ask this basic questions. Okay. Okay, they may ask this basic questions. Okay. Capillaries. There is no tunica, media. Fine. Now let us see some of the vascular anomalies. Okay, vascular anomalies. That is anatomically. That is when they are present, when the baby is born itself, at that time itself these vascular anomalies are present, and they are anatomical variants, not functional or physiological. They are not functional variants, they are anatomical variants. Number one is what we call it as developmental or berry aneurysms in cerebral vessels. Okay, and that is abnormal dilatation of the circle of Willis. Abnormal dilatation of the circle of Willis, and whenever there is rupture, there will be fatal intracerebral hemorrhage. Then there will be some direct abnormal connections between the arteries and veins. Okay, usually, for example, this is artery, this is artery, this is artery. Then we have something what we call it as capillaries. I am drawing like this, and then we have something what we call it as veins. So this is normal. This is normal. Sometimes there will be direct connection between these arteries and veins. They will bypass these capillaries. So that is what we call it as arteriovenous fistulas. Arteriovenous fistulas. Just remember this point. Then we have another condition called as fibromuscular dysplasia, in which there will be irregular focal thickening of the medium as well as large muscular arteries like the renal, carotid, and the vertebral vessels. Okay, yes. So what is happening? Because of the thickening of the vessel wall, there will be luminal stenosis. So initially by birth itself, there will be renal artery hypertension. Okay, yes. And on angiography, you can see string of beads appearance. Strings of beads appearance. String of beads appearance. What is the string of beads appearance? Since the lumen is obstructed in angiography means what? We will be injecting contrast dye into the body, and we will be observing, I'm right, the pattern, okay, of the blood vessels. That is, what about the lumen, okay, whether it is occluded, whether it is partially stenosed, whether it is completely obstructed or occluded. All those things we can study by angiography. So that is, angiography is the study of blood vessels. It is an imaging of the blood vessels. Fine. We can see a string of beads appearance, and it may also lead to, because of the irregular thickening, what it may leads to some abnormal outpouchings. That is what we call as aneurysms. Okay, abnormal outpouchings we call it as aneurysms, and these aneurysms can rupture, leading to fatal hemorrhages. Okay, fatal hemorrhages. And the luminal stenosis, it is mainly present with the renal artery hypertension. Now let us see what are the vascular responses to injury. I have already told you about the endothelial cells. Am I right? Endothelial cells are present in the renal glomerulus, liver sinusoids, everything. So remember, these endothelial cells, they may be either continuous. Okay, we have two types of capillaries. One is called as continuous capillaries, and another one is called as fenestrated capillaries. Continuous capillaries means what? There won't be any gaps between them. That is mainly present in blood-brain barrier. Okay, in the brain. And we have, at the same time, we have something called as fenestrated capillaries, which will allow the passage of some molecules. That is mainly seen in the liver and the splenic sinusoids. Fine. Yes. So we have lot of functions of the endothelial cells. Some I would like to mention. They have a non-thrombogenic surface. They will always maintain the blood in the fluid state. Okay. They mainly help in metabolizing hormones. Okay. And they also what helps to maintain the normal blood pressure. Everything. So these are some of the most common, the most important function. What I would like to mention as far as the pathology is concerned is the endothelial cells always have a non-thrombogenic state. It will always prevent the formation of thrombus. Whenever there is an alteration of the functions of the endothelium, thrombus formation sets in. Fine. Yes, that is endothelial activation due to inflammation, due to diabetes, okay, any other substance deposition, whatever it may be. It will lead to vasoactive, vasoconstrictive molecules, which will finally leads to disruption of the non-thrombogenic state of the endothelial cells, leading to formation of thrombus. This thrombus may dislodge and they may get to embolism. Okay. Yes. See. These are the basal and activated state. Okay, normally we will have, see, this is normally we will have a normotension, laminar flow, anti-growth factors like VEGF. Okay, yes. So at the same time, what happens? There will be in the basal state, we have a non-adhesive, non-thrombogenic surface. What do you mean by the word non-adhesive? That means nothing can attach to the endothelial cells when it is at the basal state. But at the activated state, because of some of the reasons which I have mentioned here, turbulent flow, hypertension, complement, bacterial products, advanced glycation end products in case of diabetes mellitus, hypoxia acidosis, viruses, viral infection, cigarette smoke, all these will cause increased expression of procoagulants. That is the mechanism that we have studied in the chapter hemodynamics. Altered expression of chemokines, cytokines. So procoagulant molecules will start releasing, and there will be adhesion, there will be a thrombogenic state. Okay, all those things will set in. So okay, that is the reason. Okay. Then I have already told you that the endothelial cells will always be maintained in a non-thrombostin state. This is because of production of some important. There is always a balance between vasodilating and vasoconstricting. Okay, that is like nitric oxide and endothelin. Nitric oxide is a vasodilator, whereas endothelin is a strong, potent vasoconstrictor. So there will be always a balance. Whenever there is a disruption of this balance, problem starts. So endothelial dysfunction is actually because of this disruption in the balance between procoagulant and anticoagulant state. Fine? Yes. Okay. Then we have something what we call as an intimal thickening. What is that? Intima. Tunica intima is made up of endothelial cells. So what I can say, I'm just making a statement that the intimal thickening is the stereotypical response of the vessel wall to any insult. Whatever be the nature of the injury, that whenever there is an intimal thickening, it indirectly indicates that the vessel wall has injured. Okay, that is endothelial cell injury. Fine? Yes. Okay. See, you can see here, there's a stereotypical response to vascular injury. There is a recruitment of smooth muscle cells. We can see the recruitment of smooth muscle cells. Okay. Yes. Then smooth muscle cells undergo proliferation, extracellular matrix. What? See, you can see here the normal thickness. See, this is the thickness is very small, but this here the thickness increases. Okay. See the tunica intima. No, say the tunica intima because of the initially there will be endothelial dysfunction. There will be recruitment of the smooth muscle cells. Where are smooth muscle cells usually found? In the tunica media and adventitia, or mainly in the media. Whereas in endothelial cell dysfunction, in endothelial injury, the smooth muscle cells are recruited from media to intima. There will be smooth muscle cell proliferation. There will be elaboration of the extracellular matrix. This is the reason why for which whenever there is a vascular injury, there will be there will be tunica intima thickening. See, you can see that the thickness of tunica intima has exceeded the thickness of tunica media. So that is the statement I have made. That is, intimal thickening is a stereotypical response of vessel wall to any insult. So whenever they ask about any of the condition which is going to mainly affect the tunica intima, now you are very clear what are happening, what is the pathology. So this is what you are going to. But in each disease there will be some hallmark features. Rest every basic pathogenesis mechanism for all the conditions, okay, that what we are going to discuss in the upcoming sessions remains the same. That is endothelial injury, intimal thickening, okay. Yes, there will be thickness of the intima will be exceeding that of the tunica media, okay. Then procoagulant state. So all this, okay, this is the basic concept you have to remember. Fine. So what is that? Result is intimal thickening. Whenever there is a vascular injury, whenever endothelial cell dysfunction is there will be stimulation of smooth muscle cell proliferation, mitosis, matrix synthesis leading to intimal thickening. So intimal thickening is a hallmark feature of any vascular injury. Okay. Yes, it is one of the most important stereotypical response of the vessel wall to any type of insult. That is intimal thickening. So with this, we have finished. Just remember, continuous and fenestrated in case of liver and splenic sinusoids, continuous in blood-brain barrier. Then I have told you what is the stereotypical response. Okay, stereotypical response. What is stereotypical response? Yes, stereotypical response is intimal thickening to any type of vascular insult. There are recruitment of smooth muscles with the extracellular matrix deposition. Okay, so what happens next? What is the consequence of this intimal thickening? Yes, what happens? So this is the normal blood vessel. This is the normal blood vessel. I am drawing the 3 layers. So this is the normal lumen. This is the normal lumen. I am writing N. Okay, whenever there is an intimal thickening, okay, intimal thickening. Okay, this is then again 1, 2, and the third layer I am drawing with the yellow thing to show the thickness. Okay, the thick end. You can see that lumen stenosis. When lumen stenosis happen, what is the clinical feature? Increased blood pressure. Yes, this is the basic pathogenesis mechanism behind all type of vascular pathologies. In the next session, I will be discussing a very important, very common condition that we are encountering in our day-to-day life, that is hypertension. What is the vascular response in case of a hypertensive patient, or in hypertension, what is the type of vascular? Again, the basic pathology remains the same. We will see what are the causes of hypertension. We will see what is the, in addition to all those responses to an injury what we have mentioned so far, in addition in hypertension, what will be the other features. Okay, so in this session, this is the first session in systemic path, CVS path, blood vessels, vascular response to injury. So I hope you all have enjoyed this session. Okay, please go back, revise your basic anatomy, what are the different types of capillaries, what are the layers, and what is the vascular response in case of an injury. Remember, intimal thickening. Fine, thank you.